Hi, I'm Amy Gamboa, and I'm going to be showing you today how to go ahead and set up an IV piggyback with already a main line set up. So the first thing you're going to want to do is look at your drug order, and when you take it out of the Pyxis, that's going to be your first check. Your second check is going to be preparing the piggyback, and then your third check is always going to be at the patient's side. Also, before you administer any type of drug, you're also going to want to check the patient's chart, making sure that if they've ever had this type of drug before, and if so, were they allergic, what type of reactions did they have. And another main thing you want to check is making sure you check the compatibility with your drug along with the main line, okay? And for my purpose, I have already done that. The antibiotic that I am giving is Ansep, and it is compatible with my main line, which is the lactated ringer. So for my little purpose, I didn't have a package, so I'm going to go ahead and just use my supplies, and I'll let you know what I have here. So I have my drug order here, my hook, and my tubing, which is pretty much what you find in your package when you open it. Also, once you are at the bedside, you're going to want to check your patient's IV site. There's already a main line running, so that's good, but you want to make sure that they're tolerating it well and making sure there's no reaction going on. So I don't see any redness, warmth, or any tenderness on the side. So that's going to be your first thing you're going to want to do. After you open up your package, you're going to want to clamp your tubing because you don't want anything leaking out. So that's the first thing you're going to want to do. Afterwards, go ahead and spike your medicine, making sure that the top of this portion does not touch anything else because you don't want to contaminate anything. When you push it in, making sure that it is snug so nothing will leak out. And then for your main line, I'm going to go ahead and attach, but I want to go ahead and pause my main line for the time being, because you are going to be attaching it to this port. Usually there is caps here, but if there's not, that's when you have to go ahead and use an alcohol swab. And then go ahead and just clean that for 15 seconds. And then try not to touch anything like I said. Then you will attach your tubing, making sure that's snug. And then you want to back prime it. So you're going to have to unclamp this real quick. Making sure also there's no bubbles in your tubing. You don't want to fill the little capsule too high because you want to make sure that you're going to be able to see your first drip on there. So we're good to go on that. And then we will lower our main line with our hook. And since I have back primed, I'm going to clamp your main line. And then setting up, we're going to go ahead and hit restart. Oh, there we go. Check IVs. Okay. And then we'll do channel select, find your secondary button. Then my drug order was for, let's go down. Drug order was for 2,000 milligrams, which is the same as 2 grams. Is this correct? Yes. 2 grams, 0.2, next. And it's in 100 mils. And it shows you volume, duration, set up. Then we'll go ahead and start making sure everything is unclamped. And then you want to wait to see that you first drop. You never want to leave the patient until you see it come out. And then you're also going to want to label your actual drug and then label the tubing as well, which is 96 hours from when it is. Included patient sign. Everything should be running. Yeah, there you go. And that's how you set up an IV piggyback. Thank you.